Getting ready for your cosmetology license exam? One of the most important areas is infection control and safety, a topic you can expect to be tested on when you take your exam. In this video, we'll cover pathogens and transmission, sanitization and disinfection, and OSHA standards and first aid. And don't miss what's happening in the lower corner. It could be key to your exam prep. Now, let's get started.
Let's start with a review of pathogens and disease transmission. Types of pathogens and examples. Which of the following is a characteristic of bacterial pathogens? Is it A, they require a host cell to replicate? B, they are single-celled organisms that can reproduce independently? C, they form spores to survive harsh conditions? Or D, they are composed of hyphae? The answer is B. They are single-celled organisms that can reproduce independently. The options include characteristics of viruses and fungi, which might confuse those not familiar with pathogen types. Bacteria are single-celled organisms that can reproduce independently. A hospital is investigating an outbreak of a disease caused by a virus. Which of the following measures is most effective in preventing the spread of viral pathogens? Is it A, using antibiotics? B, increasing humidity in the environment? C, practicing proper hand hygiene? Or D, applying antifungal creams? The answer is C, practicing proper hand hygiene. The options include measures effective against different pathogen types. Hand hygiene is universally effective against viruses.
Have you noticed the code in the bottom corner? Next time you're stumped, take that code to birdsy.ai for immediate help and a free study session with Birdsy, your personal AI study partner. Plus, you'll get access to hundreds of additional questions, helping you move closer to passing your exam with confidence. The next time you're feeling unsure or stuck, give it a try.
Which type of pathogen is responsible for athlete's foot? Is it A, bacteria? B, viruses? C, protozoa? Or D, fungi? The answer is D, fungi. The options include common pathogens, but only fungi cause athlete's foot. Misidentifying the pathogen type is a common error. A farmer notices that his crops are affected by a fungal infection. Which of the following actions should he take to manage the fungal pathogen? Is it A, apply fungicides to the crops? B, use antiviral sprays? C, administer antibiotics to the plants? Or D, increase nitrogen fertilizer application? The answer is A, apply fungicides to the crops. The options include actions for different pathogen types. Fungicides are specifically designed to target fungi. Which of the following is an example of a viral pathogen? Is it A, Staphylococcus aureus? B, Candida albicans? C, influenza virus? Or D, Plasmodium falciparum? The answer is C, influenza virus. The options include various pathogens. Only the influenza virus is a viral pathogen, which might be confused with bacterial or fungal examples. Which of the following is a characteristic of bacteria that distinguishes them from viruses? Is it A, they require a host to replicate? B, they are living cells that can reproduce independently? C, they have a protein coat? Or D, they are always harmful to humans? The answer is B. They are living cells that can reproduce independently. The distractors include features that are common to both bacteria and viruses. Bacteria are living cells that can reproduce independently, unlike viruses. A patient is diagnosed with athlete's foot, a common fungal infection. Which type of pathogen is responsible for this condition? Is it A, bacteria? B, virus? C, fungus? Or D, parasite? The answer is C, fungus. The distractors include other types of pathogens. Athlete's foot is caused by a fungus, not bacteria or viruses. Which of the following diseases is caused by a virus? Is it A, influenza, B, tuberculosis, C, ringworm, or D, malaria? The answer is A, influenza. The distractors include diseases caused by other types of pathogens. Influenza is a viral infection. A laboratory technician is tasked with identifying a pathogen that has a cell wall but lacks a nucleus. Which type of pathogen is this likely to be? Is it A, virus, B, bacteria, C, fungus, or D, protozoa? The answer is B, bacteria. The distractors include pathogens with different structures. Bacteria have cell walls and lack a nucleus. What is a common characteristic of fungi that differentiates them from bacteria? Is it A, they are single-celled organisms, B, they lack a cell wall, C, they reproduce by binary fission, or D, they have a complex cellular structure with a nucleus? The answer is D. They have a complex cellular structure with a nucleus. The distractors include characteristics that are not unique to fungi. Fungi have a complex cellular structure with a nucleus. Which of the following is an example of a bacterial pathogen? Is it A, influenza virus, B, streptococcus, C, candida, or D, HIV? The answer is B, streptococcus. The options include examples of different types of pathogens, which could confuse those not familiar with specific examples. Bacteria like streptococcus are common pathogens. A patient is diagnosed with a fungal infection. Which of the following pathogens is most likely responsible? Is it A, Escherichia coli, B, Varicella zoster, C, candida, or D, Mycobacterium tuberculosis? The answer is C, candida. The options include pathogens from different categories, which could mislead those unfamiliar with specific fungal examples. Candida is a common fungal pathogen.
If you're finding this helpful, please take a minute to like this video and subscribe to our channel for more practice exams, useful tips, and complimentary study sessions with Birdsy.
How infections spread. Which of the following best describes the term fomite in the context of disease transmission? Is it A, a living organism that transmits disease, B, an inanimate object that can carry infectious agents, C, a type of airborne particle, or D, a bodily fluid that transmits disease? The answer is B, an inanimate object that can carry infectious agents. The term fomite might be confused with other transmission modes. Fomites are inanimate objects that can carry infectious agents. A hospital reports that 15% of its infections are due to airborne transmission. If there are 200 infections in a month, how many are likely due to airborne transmission? Is it A, 20, B, 25, C, 30, or D, 35? The answer is C, 30. The distractors might result from incorrect percentage calculations. Multiply 200 by 0.15 to find the number of airborne infections. What is the primary mode of transmission for communicable diseases like the common cold? Is it A, direct contact with infected individuals, B, vector-borne transmission, C, waterborne transmission, or D, fomite transmission? The answer is A, direct contact with infected individuals. The common cold can spread in multiple ways, but direct contact is the most common mode. In a community, 40% of infections are transmitted via direct contact. If there are 500 reported cases, how many are due to direct contact? Is it A, 150, B, 200, C, 250, or D, 300? The answer is B, 200. The distractors might arise from incorrect percentage application. Multiply 500 by 0.40 to find the number of direct contact infections. Which of the following is a characteristic of vector-borne transmission? Is it A, transmission through contaminated food, B, transmission via direct contact with an infected person, C, transmission through airborne particles, or D, transmission by living organisms such as mosquitoes? The answer is D, transmission by living organisms such as mosquitoes. Vector-borne transmission involves living organisms, which might be confused with other transmission modes. A healthcare worker needs to calculate the basic reproduction number for a new virus. If each infected person spreads the virus to 3 others on average, what is the R0? Is it A, 1, B, 2, C, 3, or D, 4? The answer is C, 3. The distractors may confuse the concept of R.0 with other transmission metrics. The R.0 is simply the average number of secondary cases per infected individual. What does the term fomite transmission refer to in the context of disease spread? Is it A, direct contact between individuals, B, transmission via contaminated surfaces, C, airborne spread through droplets, or D, vector-borne spread through insects? The answer is B, transmission via contaminated surfaces. The distractors include other modes of transmission that might confuse the reader. Fomite transmission specifically involves inanimate objects. In a community, the attack rate of a flu outbreak is calculated. If 200 out of 1,000 people become infected, what is the attack rate percentage? Is it A, 20%, B, 2%, C, 50%, or D, 5%? The answer is A, 20%. The distractors may result from incorrect percentage calculations. The attack rate is the number of cases divided by the population, multiplied by 100. Levels of infection control. Sanitation versus disinfection versus sterilization. Which of the following best describes the process of sterilization? Is it A, reduces microbial load to safe levels, B, eliminates all forms of microbial life, C, kills most bacteria and viruses, or D, removes visible dirt and debris? The answer is B, eliminates all forms of microbial life. The distractors might confuse sterilization with other levels of infection control. Sterilization is the complete elimination of all forms of microbial life. A hospital needs to ensure that surgical instruments are free from all microorganisms. Which method should they use to achieve this? Is it A, sanitation, B, disinfection, C, sterilization, or D, cleaning? The answer is C, sterilization. The options include methods that do not achieve complete sterility. Only sterilization ensures all microorganisms are eliminated. What is the primary tool used in the process of disinfection? Is it A, chemical disinfectants, B, autoclave, C, soap and water, or D, ultraviolet light? The answer is A, chemical disinfectants. The options include tools used in other processes. Disinfectants are specifically used to kill most pathogens. A restaurant kitchen needs to ensure that their cutting boards are safe for food preparation. Which level of infection control should they apply? Is it A, Sterilization. B. Disinfection. C. Sanitation. Or D. Cleaning? The answer is B. Disinfection. The options include levels of control that are too extreme or insufficient. Disinfection is appropriate for food preparation surfaces. Which level of infection control involves the use of an autoclave? Is it A. Sanitation, B. Disinfection, C. Cleaning, or D. Sterilization? The answer is D. Sterilization. The options include processes that do not require an autoclave. An autoclave is specifically used for sterilization. Which level of infection control involves the complete elimination of all microbial life, including spores? Is it A. Sanitation, B. Disinfection, C. Sterilization, or D. Cleaning? The answer is C. Sterilization. The distractors might confuse sterilization with other levels of control like disinfection or sanitation. Sterilization is the only method that eliminates all forms of microbial life. A hospital needs to ensure that surgical instruments are free from all microbial life. Which process should they use to achieve this? Is it A. Sanitation, B. Sterilization, C. Disinfection, or D. Cleaning? The answer is B. Sterilization. The options might seem similar, but only sterilization ensures complete elimination of all microbial life, which is crucial for surgical instruments. What is the primary difference between disinfection and sterilization? Is it A. Sterilization eliminates all microbial life, including spores, while disinfection does not? B. Disinfection is more thorough than sterilization? C. Both processes eliminate all microbial life? Or D. Disinfection is used for surgical instruments? The answer is A. Sterilization eliminates all microbial life, including spores, while disinfection does not. The terms are often used interchangeably, but only sterilization ensures the complete elimination of all microbial life, including spores. A cleaning crew is tasked with reducing microbial contamination on surfaces in a public restroom. Which level of infection control should they apply? Is it A. Sterilization, B. Disinfection, C. Cleaning, or D. Sanitation? The answer is D. Sanitation. The options might seem similar, but sanitation is the appropriate level for reducing microbial contamination to safe levels in public areas. Which tool is commonly used in the sterilization process to ensure all microbial life is eliminated? Is it A. Disinfectant spray, B. Autoclave, C. Mop and bucket, or D. UV light? The answer is B. Autoclave. The options include tools used in various levels of infection control, but an autoclave is specifically used for sterilization. Which of the following best describes the process of sterilization in infection control? Is it A. Reduces the number of pathogens to a safe level, B. Kills most microorganisms but not spores, C. Eliminates all forms of microbial life, or D. Removes visible dirt and debris? The answer is C. Eliminates all forms of microbial life. The distractors might confuse sterilization with other levels of infection control. Sterilization is the complete elimination of all forms of microbial life.
If you're finding this helpful, please take a minute to like this video and subscribe to our channel for more practice exams, useful tips, and complimentary study sessions with Birdsy.
Proper procedures for cleaning tools and work areas. What is the first step in the proper procedure for cleaning tools used in infection control? Is it A. Disinfect the tools. B. Remove visible debris. C. Sterilize the tools. Or D. Rinse with water. The answer is B. Remove visible debris. The options include steps that are part of the process, but not the first. The correct first step is to remove visible debris. A cleaning agent needs to prepare a disinfectant solution with a concentration of 10%. If they have 500 milliliters of water, how much disinfectant should they add? Is it A, 45 milliliters, B, 50 milliliters, C, 55.56 milliliters, or D, 60 milliliters? The answer is C, 55.56 milliliters. The distractors use incorrect calculations of concentration. The correct amount is 55.56 milliliters, calculated as 10% of the total solution, 555.56 milliliters. Which of the following is a key component of the sterilization process? Is it A, heat, B, soap, C, alcohol, or D, water? The answer is A, heat. The options include steps from different processes. Heat is a primary component of sterilization. An infection control specialist needs to disinfect a work area of 200 square meters. If the disinfectant covers 5 square meters per liter, how many liters are needed? Is it A, 35 liters, B, 40 liters, C, 45 liters, or D, 50 liters? The answer is B, 40 liters. The distractors result from incorrect division. The correct amount is 40 liters, calculated by dividing the area by the coverage rate. What is the purpose of using a disinfectant in infection control procedures? Is it A, remove dirt, B, sterilize surfaces, C, moisturize surfaces, or D, kill or inactivate pathogens? The answer is D, kill or inactivate pathogens. The options include purposes of other cleaning agents. Disinfectants are specifically used to kill or inactivate pathogens. What is the first step in the proper procedure for cleaning tools and work areas to ensure effective infection control? Is it A, disinfecting with a chemical solution, B, removing visible debris, C, rinsing with water, or D, drying the tools? The answer is B, removing visible debris. The options include steps that are part of the process but not the initial one. The correct approach starts with removing debris before any cleaning or disinfecting. A salon worker needs to clean 15 tools after a busy day. If each tool requires 2 minutes for debris removal and 3 minutes for disinfection, how long will it take to clean all the tools? Is it A, 30 minutes, B, 45 minutes, C, 75 minutes, or D, 90 minutes? The answer is C, 75 minutes. The distractors may result from miscalculating the total time per tool. You're forgetting to multiply by the number of tools. The correct calculation is 5 minutes per tool times 15 tools. Which of the following is a key component of a disinfectant solution used in infection control? Is it A, quaternary ammonium compounds, B, water, C, soap, or D, baking soda? The answer is A, quaternary ammonium compounds. The options include substances that might be confused with disinfectants. The correct component is a chemical known for its disinfecting properties. Universal Precautions and OSHA standards. Universal Precautions and CDC Handwashing Guidelines. According to CDC Guidelines, what is the minimum recommended duration for washing hands with soap and water to effectively remove germs? Is it A, 10 seconds, B. 20 seconds. C. 30 seconds. Or D. 15 seconds. The answer is B. 20 seconds. The distractors include common misconceptions about hand washing duration. The CDC recommends at least 20 seconds for effective hand washing. What is the primary purpose of universal precautions as defined by OSHA standards? Is it A. Prevent transmission of bloodborne pathogens? B. Ensure patient comfort? C. Reduce healthcare costs? Or D. Improve healthcare worker efficiency? The answer is A. Prevent transmission of bloodborne pathogens. The distractors include related but incorrect purposes. Universal precautions aim to prevent transmission of bloodborne pathogens. A nurse follows universal precautions and uses gloves for each of 25 patient interactions. If each pair of gloves costs $0.50, what is the total cost for the gloves used in one day? Is it A. $10, B. $12.50, C. $15, or D. $20? The answer is B. $12.50. The distractors arise from incorrect multiplication. Multiply 25 interactions by $0.50 per pair to find the total cost. Which of the following is a key component of the CDC's handwashing guidelines? Is it A. Using hand sanitizer exclusively? B. Rinsing hands with cold water? C. Drying hands with a towel? Or D. Washing with soap and water for at least 20 seconds? The answer is D. Washing with soap and water for at least 20 seconds. The distractors include steps not emphasized by the CDC. The CDC emphasizes using soap and water for at least 20 seconds. A healthcare worker needs to calculate the time required for effective hand washing according to CDC guidelines. If the worker spends 10 seconds applying soap and 15 seconds rinsing, how long should they spend scrubbing their hands to meet the minimum recommended duration? Is it A. 5 seconds, B. 20 seconds, C. 10 seconds, or D. 15 seconds? The answer is B. 20 seconds. The distractors include incorrect total times or misinterpret the CDC guideline. The correct approach is to subtract the time spent applying soap and rinsing from the total recommended duration of 20 seconds. According to universal precautions, what is the primary purpose of wearing gloves when handling potentially infectious materials? Is it A. To prevent skin irritation? B. To enhance grip on medical instruments? C. To prevent direct contact with infectious materials? Or D. To comply with hospital dress codes? The answer is C. To prevent direct contact with infectious materials. The distractors suggest secondary benefits or unrelated reasons. The primary purpose is to prevent direct contact with infectious materials. A nurse is preparing to clean a spill of blood on the floor. According to OSHA standards, what is the minimum concentration of bleach solution required to effectively disinfect the area? Is it A. 1 to 10, B. 1 to 100, C. 1 to 5, or D. 150? The answer is A. 1 to 10. The distractors include incorrect concentrations or misinterpret the OSHA standard. The correct concentration is 1 to 10 bleach to water. What is the minimum duration recommended by the CDC for effective hand washing with soap and water? Is it A. 10 seconds, B. 20 seconds, C. 30 seconds, or D. 15 seconds? The answer is B. 20 seconds. The distractors include incorrect durations that are commonly misremembered. The CDC recommends washing hands for at least 20 seconds to ensure effectiveness.
Stuck on a question? Just think of the Birdsy link in the description as your friendly neighborhood superhero, swooping in to save the day with answers. Feel free to explore it now and return to continue. Simply hit pause, and we'll be waiting when you get back.
Relevant OSHA standards, e.g. bloodborne pathogens, PPE basics. What is the primary purpose of the bloodborne pathogen standard according to OSHA? Is it A, to ensure all employees receive vaccinations? B, to protect workers from health hazards caused by bloodborne pathogens? C, to regulate the disposal of all medical waste? Or D, to mandate the use of personal protective equipment in all workplaces? The answer is B, to protect workers from health hazards caused by bloodborne pathogens. The options include common misconceptions about the standard scope. The correct answer focuses on protection against exposure to bloodborne pathogens. A healthcare worker needs to calculate the correct dilution of bleach for disinfecting surfaces. If the recommended dilution is 1 to 10, how much bleach is needed for 1 liter of solution? Is it A, 10 milliliters, B, 100 milliliters, C, 200 milliliters, or D, 500 milliliters? The answer is C, 200 milliliters. The distractors include common errors in dilution calculations. The correct approach is to calculate 1/10 of the total solution volume. Which of the following is a T component of the personal protective equipment basics under OSHA standards? Is it A, providing protection against workplace hazards? B, ensuring all employees are trained in CPR? C, maintaining a clean and organized workspace? Or D, implementing ergonomic workstations? The answer is A, providing protection against workplace hazards. The options include elements not directly related to PPE. The correct answer focuses on PPE's role in hazard protection. A healthcare worker needs to calculate the appropriate amount of personal protective equipment for a shift. If the OSHA standard requires 3 pairs of gloves, 2 masks, and 1 gown per worker per shift, how many total PPE items are needed for 5 workers? Is it A, 20, B, 30, C, 25, or D, 35? The answer is B, 30. The distractors might result from miscalculating the total PPE items per worker or multiplying incorrectly. The correct approach is to multiply each PPE item by the number of workers and sum them. A healthcare worker needs to calculate the correct amount of personal protective equipment needed for a 12-hour shift. If each worker requires 3 sets of PPE per 4-hour period, how many sets are needed for the entire shift? Is it A, 6 sets, B, 8 sets, C, 9 sets, or D, 12 sets? The answer is C, 9 sets. The distractors may result from miscalculating the total hours or sets needed. The correct approach is to multiply the number of sets per 4-hour period by the number of 4-hour periods in a 12-hour shift. In the context of OSHA's bloodborne pathogens standard, what does the term universal precautions refer to? Is it A, treating all human blood and certain body fluids as if they are infectious? B, using PPE only when there is a known infection risk? C, disposing of all medical waste in regular trash? Or D, washing hands only after visible contamination? The answer is A, treating all human blood and certain body fluids as if they are infectious. The distractors might confuse universal precautions with other safety measures. The correct understanding is that universal precautions involve treating all human blood and certain body fluids as if they are infectious. First aid and blood exposure response. First aid for burns, cuts, and minor injuries. A person has a minor burn on their arm. To cool the burn effectively, they should run it under cool water for how many minutes? Is it A, 5 minutes, B, 15 minutes, C, 30 minutes, or D, 1 minute? The answer is B, 15 minutes. The distractors suggest incorrect durations that are either too short or too long. The correct approach is to cool the burn under cool water for 10 to 20 minutes. What is the primary purpose of using an antiseptic on a cut? Is it A, to stop bleeding, B, to promote healing, C, to prevent infection, or D, to reduce pain? The answer is C, to prevent infection. The distractors suggest purposes that are not the primary role of antiseptics. The correct purpose is to prevent infection by killing or inhibiting bacteria. After cleaning a minor cut, you need to apply a dressing. If the cut is 5 centimeters long, what size dressing should you use to ensure it covers the wound adequately? Is it A, 7 centimeters, B, 5 centimeters, C, 10 centimeters, or D, 3 centimeters? The answer is A, 7 centimeters. The distractors suggest dressings that are either too small or unnecessarily large. The correct size should cover the wound with some margin, typically 1 to 2 centimeters extra on each side. What is the first step in treating a minor cut? Is it A, apply a bandage, B, apply antiseptic, C, stop the bleeding, or D, clean the wound? The answer is D, clean the wound. The distractors suggest steps that are important, but not the first. A correct first step is to clean the wound to prevent infection. You are treating a minor burn and have cooled it under water. What is the next step to ensure proper first aid? Is it A, apply ice directly, B, apply ointment, C, cover with a sterile dressing, or D, leave it uncovered? The answer is C, cover with a sterile dressing. The distractors suggest steps that are either unnecessary or incorrect. The correct next step is to cover the burn with a sterile dressing to protect it. What is the first step in providing first aid for a minor burn? Is it A, apply antiseptic cream, B, cool the burn under running water, C, cover with a dry dressing, or D, take pain relief medication? The answer is B, cool the burn under running water. The distractors suggest incorrect initial actions. The correct first step is to cool the burn under running water. A person has a minor cut on their finger. They have a 100 milliliter bottle of antiseptic. If each application uses 5 milliliters, how many applications can they perform? Is it A, 15, B, 25, C, 20, or D, 10? The answer is C, 20. The distractors involve incorrect division or multiplication. Dividing 100 milliliters by 5 milliliters per application gives 20 applications. Which of the following is a key component of a sterile dressing? Is it A, germ-free material, B, cotton wool, C, adhesive tape, or D, gauze bandage? The answer is A, germ-free material. The distractors include non-sterile materials. A sterile dressing must be free from germs and contaminants. A person needs to apply a dressing to a 10 centimeter long cut. If each dressing covers 2 centimeters, how many dressings are needed? Is it A, 4, B, 6, C, 3, or D, 5? The answer is D, 5. The distractors involve incorrect division or rounding. Dividing 10 centimeters by 2 centimeters per dressing gives 5 dressings. What is the purpose of using antiseptics on a wound? Is it A, to stop bleeding, B, to promote healing, C, to prevent infection, or D, to reduce pain? The answer is C, to prevent infection. The distractors suggest incorrect purposes. Antiseptics are used to prevent infection by killing or inhibiting bacteria. When treating a minor burn, which of the following steps is essential to ensure proper first aid care? Is it A, apply ice directly to the burn, B, cool the burn with running water, C, cover the burn with an ointment, or D, leave the burn open to air? The answer is B, cool the burn with running water. The options include common misconceptions about burn treatment. The correct step is cooling the burn with running water, not ice or ointments. Blood exposure procedures and disposal protocols. Which of the following is the correct first step in the blood exposure procedure? Is it A, apply a bandage immediately, B, stop the bleeding and wash the area with soap and water, C, report the incident to a supervisor, or D, seek medical attention? The answer is B, stop the bleeding and wash the area with soap and water. The distractors include steps that are important but not the first. The correct first step is to stop the bleeding and wash the area with soap and water. A healthcare worker accidentally gets a blood splash on their face. What is the correct procedure to follow immediately after the incident? Is it A, apply antiseptic cream, B, report the incident to a supervisor, C, flush the area with water, or D, seek medical evaluation? The answer is C, flush the area with water. The distractors suggest actions that are important but not immediate. The correct action is to flush the area with water to reduce contamination risk. What is the recommended method for disposing of blood-soaked materials? Is it A, place in a biohazard bag, B, throw in regular trash, C, flush down the toilet, or D, burn in an incinerator? The answer is A, place in a biohazard bag. The distractors include methods that are not suitable for biohazardous waste. Blood-soaked materials should be disposed of in a biohazard bag. During a procedure, a nurse gets a needle stick injury. What is the correct sequence of actions they should take? Is it A, report the incident, wash the area, seek medical evaluation, B, seek medical evaluation, wash the area, report the incident, C, wash the area, seek medical evaluation, report the incident, or D, wash the area, report the incident, seek medical evaluation? The answer is D, wash the area, report the incident, seek medical evaluation. The distractors mix up the sequence of actions. The correct sequence is to wash the area, report the incident, and then seek medical evaluation. What is the purpose of using a sharps container in blood exposure procedures? Is it A, to store medical supplies, B, to sterilize used needles, C, to safely dispose of needles and prevent injury, or D, to recycle medical waste? The answer is C, to safely dispose of needles and prevent injury. The distractors suggest purposes that are not specific to sharps containers. The purpose is to safely dispose of needles and prevent injury. What is the first step in the blood exposure disposal protocol when dealing with contaminated materials? Is it A, disinfect the area, B, place materials in a biohazard bag, C, label the bag with the date, or D, transport to disposal facility? The answer is B, place materials in a biohazard bag. The distractors suggest steps that are not initial actions. The correct first step is to contain the contaminated materials in a biohazard bag. A healthcare worker accidentally exposes their skin to blood. What is the correct sequence of actions they should take according to blood exposure procedures? Is it A, report the incident, then wash the area? B, apply antiseptic, then report the incident? C, wash the area, then report the incident? Or D, seek medical evaluation, then wash the area? The answer is C, wash the area, then report the incident. The sequence of actions is crucial. The correct order starts with washing the area, then reporting the incident. Which of the following is a key component of the blood exposure response protocol? Is it A, immediate washing of the exposed area? B, filing a workplace incident report? C, notifying the patient's family? Or D, scheduling a follow-up appointment? The answer is A, immediate washing of the exposed area. The distractors include actions not specific to blood exposure. Immediate washing is a key component. During a procedure, a nurse gets a small cut on their hand and is exposed to blood. If the nurse follows the correct blood exposure procedure, what should they do after washing the area? Is it A, apply a bandage? B, seek immediate medical evaluation? C, disinfect the area? Or D, report the incident to a supervisor? The answer is D, report the incident to a supervisor. The distractors suggest actions that are not immediate follow-ups. Reporting the incident is the next step after washing. Which item should be used to dispose of sharp objects contaminated with blood? Is it A, plastic bag? B, regular trash bin? C, puncture-proof container? Or D, biohazard bag? The answer is C, puncture-proof container. The distractors suggest containers not suitable for sharps. A puncture-proof container is required for safety. When disposing of contaminated materials after a blood exposure incident, which of the following is the correct protocol to ensure safety and compliance? Is it A, place materials in a regular trash bin? B, seal materials in a biohazard bag and follow disposal regulations? C, rinse materials with water before disposal? Or D, burn materials in an open area? The answer is B, seal materials in a biohazard bag and follow disposal regulations. The distractors include steps that are either unnecessary or out of order. The correct approach involves sealing materials in a biohazard bag and following disposal regulations.
Thanks for joining us today. If you found this video helpful, subscribe to our channel for more practice exams, tips, and tricks. And don't forget to visit birdsy.ai for complimentary study sessions with Birdsy, your AI-powered study partner.